Hi there, Dr. Lyle Love here, again from the Kirkland Spine and Posture Center. Today I want to talk about neck pain. Most neck pain is preventable. It comes from misalignments of the neck most of the time. The neck, when healthy, has a nice C shape to it, and then when it's unhealthy, most of the time it is straight or much more straight than it should be, so like this. And this causes additional stress and strain to the tissues, soft tissues, and the joints of the neck, and it actually weakens the spine itself. I want you to watch, and I'm going to show you how I can demonstrate how when the spine is curved properly, it's nice and strong, and then when it is straight, it's actually much, much weaker. And so if you take a look at this model here, you will see that, so here we have a spine. And if you can take a look here, you can see the way the neck is actually curving, and there is that C shape, that curve like this. And then your head is sitting on top here. Well, if it's curved like this, I'm going to put some pressure down, and I'm going to put a lot of pressure, and I mean I'm putting a lot of pressure there. And you might see my face turn red there as well. That's a lot of pressure, and the spine is able to hold the head up, and with the weight of gravity, it's able to remain strong and healthy. Well, if we take the spine and then we bend it forward like that, and then I put pressure down, such as the head just on top, and then the force of gravity coming down, and what happens over time? Nothing. It's completely weak. I mean, I can barely put any pressure there, and it is completely caving in. So you can see how a spine that is, especially the neck, is not lined up properly, and it's not curved properly, it's much weaker, and then of course that's going to cause lots of stress and strain and inflammation to the joints and the tissues of your neck, and will cause neck pain. It will also cause disc problems, and it will cause arthritis, osteoarthritis over time, and bone spurs. So sadly, most of us have a condition called forward head posture, or FHP, and that's where, if you turn to the side, the head is actually far forward. And this is something that is caused by computer use and just our bad postures, basically, from sitting as much as we do. And so, at least that's one of the causes. Other causes can actually be from accidents from the past, car accidents, sports injuries, falls, things like that. Anyway, so this is something that actually you can assess on your own, or you can have a friend, a coworker, family member take a look and see where your ear is lined up with your shoulder. Okay, and actually I'm going to go grab something here. And so this is a picture of forward head posture. You can see how this lady's head is going forward, and then here's her ear, and there's a line that drops down. You can take a look and see, where does your ear drop down, and is it in front of the shoulder, or is it on top of the shoulder? If it's on top of the shoulder, that's pretty good alignment. It doesn't mean that there's no problem in the neck. Sometimes the neck is straight and we don't see it from the forward head posture itself. But if you do see your head or your ear is in front of your shoulder, then we know that that might be part of the problem that you're having. So what certainly can we do to treat this? Well, let's see. Number one, we can certainly take dangerous drugs. That's only going to mask the problem while you continue to actually get worse. You can see a physical therapist, massage therapist, or exercise. And by the way, these are all great when used appropriately, but these things will never actually fix the cause of the problem. Or you can see a chiropractor that specializes in treating the cause of the problem by actually fixing the misalignment and putting the healthy curve back into the neck. So I'm just, would like to ask you which one actually, what makes sense to you, and I'm sure that I know which one makes sense. It's fixing the actual cause of the problem. So anyway, if you would, please call the number on the screen, or click the link below, and if you are curious to see if we can help you, then we would love to meet you and see if that's a possibility for you. Okay, thanks very much for watching. Appreciate it. Bye-bye.